Thank you, Paul, colleagues. And so my charge to start this off was to give you the top 5 innovations in mitral valve therapy, although I got morphed to be the top 5 latest innovations. But given that, I still wanted to start, and here's my disclosures, with what I think one of the innovations that really has made the biggest impact over much of the world, because so much of the newer things you hear us talk about are really for patients in developed, wealthy countries. And I think I have to pay homage to Dr. Inoue and colleagues who really pioneered truly a fairly complicated device for its time for patients with rheumatic mitral valve stenosis. This Inoue balloon has variable degrees of stiffness or compliance along the balloon that allow it to seat itself in the rheumatic stenosis there, particularly given that that degree of stenosis is 3 dimensions. It's not just in the valve alone. And I think there's been quite a number of patients that have been benefited from it. We do this now on some charity missions in developing countries, and seeing the benefit you can do for patients with this disease, with this therapy, is impressive. I think then no talk about innovation can be complete if you leave off what Fred St. Gore and Al Rashdorf and Jaime Sarabia, his 2 engineers he worked with, the development of the mitral clip. And it really broke ground, and there was a lot of naysayers to it initially. But it went on to its first randomized clinical trial. And I think initially we were barking up the wrong tree a little bit with the direction we were going with that. But Everest came out, and the data supported moving it out farther and farther. And the data from COAP really has dramatically shifted the landscape. So I think being the first approved transcatheter mitral valve repair device, we really owe a lot to it. But along with that has been innovations in imaging of the mitral valve. When 3-dimensional T first came out, I was a little annoyed personally because my imager would spend all this time, ooh, look at these pretty pictures of the appendage or other things. And I'd say, focus on what we're doing. But now we've got it. So I really think 3-dimensional T imaging helps us understand the mitral pathology for those of us that don't routinely open up chests, and helps us say, what can I do here, and how can I do it when you actually get into the procedure? So this has been a real innovation in our field of mitral valve disease. And then the next innovation is, how do we apply that which we've learned from imaging and from a procedure? Where do we use it? And that's, I think, I have to give a shout out to not just the COAP trial, but that the COAP trial and the MITRA-FR trial, when you look at them together, and begin to understand who are the patients that really can be helped in secondary MR with a therapy like a MitraClip or something similar. And it's sort of like the adage of the blind man and feeling the elephant. It really takes multiple ones to really understand the big holistic picture of what you're about to do. You know, more recently, there's been a lot of resources put into innovation in TMVR, but I think we're still in search of the right patient and understanding how these therapies interact with a very complicated environment. We're still stuck in trying to enroll in these trials and getting hung up on the LVOT, on sizing. But I think I have to give also a shout out to my colleague Paul here for, I think, one of the areas that is really underserved by any other therapies is these patients with dense mitral annular calcification. And if we can do like what Paul's done with a handful of patients, treat their MAC with a TMVR type option, then I think we really have innovated in a meaningful way. Now, the next step, which in the mitral field is really going to be annuloplasty. And the Millipede device, now Boston Scientific, is helping move that along a bit farther. And Edwards with their Cardioband, we're learning a lot from that. But in terms of innovation, that place that I think is really interesting too is being touched on by Ancora's AccuCinch, where they're trying to do an annuloplasty effect, indirect one, from below the valve. And below the valve gets us into the ventricle, which on one hand makes sense, but on the other hand really opens us up to some interesting things. And I'm just going to give you some anecdotes here. From their early study, here's an example that we would have sort of expected. Patient getting significant improvement in their secondary functional MR, and that makes sense. But if you want to look carefully, how's their ventricle fare? In this patient, 6 months out, clearly the LV looks different. But also take a look at that right ventricle, which was quite dysfunctional to begin with. And this is a therapy that's restraining the basilar portions of the left ventricle, and somehow that's having effects on the right ventricle. All this is just in this slide here is just in a single patient, but it's certainly encouraging that maybe there's something there and that this is a true innovation that's going to move us on and occupy the next decade of at least all of our careers. Thank you.